Hello and welcome to today's live panel for the Shine a Light Autistic Advocate Campaign. Our topic this year is all around accessibility, and today our conversation is focusing on accessibility in healthcare. This is a hot topic. This is a big discussion area, and I am joined by three incredible advocates today. Dr. Bex Canner. Dr. Bex Canner's work focuses in health equity, specifically in inclusion for LGBTQIA patients. I have Mason Milne, who's joining us from the UK. Mason is an advocate and a Crohn's patient, and that is where his work and advocacy focuses on in healthcare. And our third panelist today is Janelle Johnson, who is a phenomenal licensed marriage and family therapist. She has Bridges Family Life Center that she co-owns with her incredible family in North Carolina. She is also the president of the North Carolina Marriage and Family Association. We are going to have a phenomenal conversation today talking all about accessibility in healthcare. We're going to be talking about some of the barriers, the intersectional areas that I think are such an important part of the conversation when we're talking about health equity. So stick around as we dive into this amazing conversation today.
Hi, I'm Carol Jean, late identified autistic ADHD human, and your host of the Mind Your Autistic Brain talk show and Burnout Restoration Unveilers community. You're about to experience the new way to thrive as a neurodistinct brain and body by getting off the chronic cycle burnout loop for good. By unveiling your authentic self, defining what thriving feels like for you, knowing your burnout signpost, so those top 20 burnout warning signs are a thing of the past, and stepping into your best life as the creator and leader you are meant to be. Get ready, because this is where we go against the mainstream, say no to outdated self-care tips, and we say yes to who we are in order to create an energized, authentic, peaceful, and harmonized world. Welcome to Mind Your Autistic Brain.
Guys, welcome to the show. I'm so excited to have each and every one of you here joining me for the conversation around accessibility in healthcare today. Welcome to all of you out here in the audience. Thank you for joining us. If you're on LinkedIn, if you're on Facebook, if you're on YouTube, we are so glad you are here. If you have questions or you have comments or something that comes up throughout the conversation today, drop that in that live chat comment. We will be able to see those. I'll be able to share any of your questions or any of your insights here with the panel today and even highlight that. So please join this conversation. This is our space. This is our place to talk about the things that matter to us in the autistic community, and especially around what those things are in healthcare for us today. So thank you so much for Dr. Bex Canner, Janelle Johnson, and Mason Milne joining us. So we're going to kick off this conversation, and I love to ask this question to just sort of set the stage, because accessibility can mean so many things to so many people. Generally, it's just the ease of use and access. But I would love to know from each one of you what accessibility and accessibility in healthcare means to you. I'm going to just kind of go in order of how you are on my screen. So Dr. Bex Canner, would you share with us, what does accessibility in healthcare mean to you?
Thank you, Carol Jean. So when I think of accessibility, I think first of access, literally the first part of the word. And access to healthcare, it's a big topic because it encompasses so many areas, not just disability accessibility, but accessibility based on gender, race, sexual orientation, gender identity, where you live, socioeconomic status or background, and disability, whether that's physical or whether that's mental health, cognitive, neurodiversity, all of the things that people struggle with in the world. I wanted to mention, just right off the bat, minority stress, which affects all of the groups of people that the intersections that I just mentioned, um, which is a health issue in itself. And so access to healthcare means all of can you actually get to a doctor or a health provider? Do you have insurance in the United States anyway? Do you have insurance? In other countries with, maybe nationalized healthcare system, my background is in New Zealand. Some of those systems still, you run up against access in terms of, waiting times, um, geographic barriers. I guess, I might have a background in rural health, which is also an accessibility problem in and of itself. And and then there are things that are barriers based on the fact that many of us find that the healthcare providers don't understand people like us or don't have systems in their practices that accommodate many of us. Um, for myself, um, I've been a part of the LGBTQ plus community, which is not a monolith, and it has changed over the years, but for decades, since the late 1980s. And at that time, access meant, sometimes lying about my sexuality or having assumptions made um, about that. About my needs based on those assumptions. I didn't know I was autistic. I didn't have some of the disabilities that I have now, um, or didn't know I did. um, and and then over time, other things have become barriers. I could probably go on way too long. I should let somebody else talk, but that's kind of the nutshell of um, what accessibility in healthcare means. Do you actually have access to equal opportunities to other people? Um, health inequities are, huge. If you look at all the literature, all the measures of health outcomes, way worse for many of us compared to more mainstream, I guess, normal people. I hate that word, but
I
whatever
know. And
that
who the
means.
heck is normal, right?
I always say the benchmark is cisgender heterosexual white men. I'll just put it out there.
Yeah. Thank you.
and
Thank you for
and
really covering such a
neurotypical, able-bodied, etc.
yeah. Yeah. And thank you so much for really covering a lot of those different areas because it's not just, you know, urban, it's rural and it's, you know, where are you living? You know, can you actually get someplace? And, you know, both of us, you and I both having moved so much, you know, in the last year or two, one of the things that I found has been a big challenge, and you touched on this, and I love it. Every time I've moved someplace, it's I have to start all over with healthcare providers, and that is not an easy thing. That's really stressful. And you know, when we moved here to Kentucky, and I finally you know ventured out and found somebody I wanted to go see after I asked around, and you know that kind of thing. And it's like, okay, I disclosed my neurotype and a lot of my co-occurring health conditions, you know, POTS and dysautonomia and things like that. And it's just, it's almost like a deer in the headlights look. And they're like, okay, great. I don't know what to do with you. And then it's almost like they're they're scared or they're just, you know, I don't know. And it just makes everything that much harder when you're like I'm telling you these things because they're important to know for communication differences, and so I'm then having to educate all the
Mm.
time around all of these different things, and that becomes exhausting. And yesterday, as I was talking about the impact of accessibility around burnout and burnout restoration, this is one of those things when you're constantly having to advocate and educate for everything to get your needs met. So thank you for all of that, Bex. Next in my row of folks is Janelle Johnson. Janelle, what does accessibility in healthcare mean to you?
First of all, Carol, Jean, thanks for having me. I'm excited to meet Bex and Mason. Looking forward to hanging out with y'all today. So, um, accessibility for me is really about forethought, um, thinking ahead about all the bodies and minds that are going to use the systems the environment, the services that someone is creating or recreating. So really, it's about being thoughtful, being mindful. And so for us at Bridges, when I started Bridges almost 6 years ago. And so I knew I was creating a space specifically for Black and Brown families that are managing mental health challenges and trauma. So thinking about designing that space and the systems is thinking about what do these humans, these particular humans, need in order to be able to access what we're providing. And that looks like thinking from long before the pandemic, we have to be hybrid. We have to have virtual and in-person services. A lot of mental health professionals weren't focused on that, 6 years ago, but we started that way because we knew the types of folks that we were going to be serving. We knew we were going to be serving new parents and just the difficulty of getting to the office with an infant. So thinking about the materials that you have available in the waiting room. You don't want to traumatize someone while they're waiting for their session. Thinking about how you set up your website, thinking about when you produce videos, is it accessible for people who are blind and low vision? Just all the things. So for me, it's really about forethought, and also considering not just one part of the human. So we are all intersectional beings. So kind of like what's already been said, we have to consider all the parts. And also how they combine. So the experience of a disabled person that's not racialized is different from the experience of a racialized person that's not disabled, and is different from those who have those things combined in one body. And all the other things. Those are just two examples because those are the two that I work with the most. But all the other identities and marginalizations that we experience on top of that. So yes, for me, I think primarily forethought and strategy.
That, from the first time we met and had a conversation, I have just absolutely adored how you talk about just the forethought. And I've told Janelle this, and I'm gonna highlight it again because she really has made such an impact in my world and in my life. She said, "Who's holding you accountable?" And I think when we're talking about forethought and we're talking about planning and we're talking about, being sure that all of the intersections and just people of for every background and in every experience to have that forethought and to be inclusive and to be affirming, we have to have someone helping externally hold us accountable. We have to also know that we don't have the perspective that everyone else is going to have. We need to go outside of ourselves. And I love that what you do in the world, Janelle, is you say, "Hey, I want to help be the person to hold you accountable. And I also want to help be the person that can add a perspective that you may not have as you're trying to be mindful in your spaces and in your businesses and in your application." And one of the things that I find is, and I hear this from so many of my friends who are people of color when it comes to mental health care. I had a great conversation with Michael Peterson, and he is just beautiful. His account on Instagram is Michael the Starseed, and he is just, oh my gosh, we had such a great conversation. And we had met in Nextability with my friend Sydney Elaine Butler, and we were talking about intersections in the autistic population. And my friends of color, I hear this so often, and Janelle, let me know if this is something that comes up in your practice, with working with families, is the identification process to get any type of mental health care or any type of identification. If you aren't like within the box of what the medical model is, and especially if you are in an intersectional population or person of color, getting that identification for something that's autistic versus something that's, anxiety or oppositional defiance disorder, all these other things really is a problem right now. The accuracy, because people are looking at, skin color and automatically making assumptions around, oh, well, this is, you just have these things, you can't possibly be autistic, right? Is that something that, you guys have noticed?
Oh, yes. In fact, that's one of the reasons why I even wanted to become a therapist, from challenges from childhood, watching family members and friends try to seek care, mental health care, and not get the support that they need. And I decided at 15, like, that's what I'm going to do. I'm going to go into psychology. So I've been studying psychology for a long time. So, but yes, you're exactly right, and it's unfortunate that that has been the case. We're starting to see some of that turnaround, specifically for autism. The CDC just released new data. One in 36 people are autistic, and at the age of 8. And the the most significant, or the populations that are being diagnosed most, are Black and Brown people for the first time. So we know that the face of autism is actually not a white person, and so there's always been this challenge in disability advocacy overall, about that, but now we're starting to see the data that actually lines up with reality, that if you are talking about autism and you're not talking about a Black or Brown person, you're not talking about how autism actually exists most often in the world.
Yes, and amen. Love that we're having more conversations, and that what we've known is actually starting to show up in the awareness and in the data that we're getting out there. Because especially for my friends, we've got Ian that's going to be joining us from the Philippines next week in our healthcare conversation. And I have a lot of friends from Malaysia and all in lots of different countries, India and things. And it's like, well, Black, Brown, Asian, Pacific Islander, I mean, this is all part. A neurotype isn't just one person, this one cookie cutter model. It's all people. And that 1 in 36, I think, is getting closer to our real number. I mean, I heard somebody or read something recently that was coming out around that number of the 1 in 36, and people are like, oh, it's getting, it's kind of like when we went through that whole finally people are becoming aware of ADHD, and they're like, oh my gosh, every time you turn around, somebody's getting, diagnosed with ADHD. And it was like, no, it's the awareness level. It's the fact that we're starting to see outside of just like this very broken and limited description of this is what this looks like and presents like, so that people are getting that information to be able to go, oh gosh, I understand myself better. I'm not broken. That's big. That's big. And I think when we're talking about accessibility in healthcare, that's an important conversation I definitely want us to dive into. Mason Milne, thank you so much for joining us. You are an incredible advocate in the UK. You work in the Crohn's area because you are also a Crohn's patient. And I love the things that you talk about and share. What does accessibility in healthcare mean for you? And sort of how did that come into your world when it comes to healthcare and access? What are some of the things that have really stood out for you, Mason?
Before I go into that, I want to say thank you to Carol Jean for allowing me to come on here today. I think it's really cool, and hearing it from Bex and Janelle as well. I completely agree with all the points that have already been shared. So what it means to me is, when I think of the word, what comes to mind is just making things easier, compromising. So if something is a little bit hard, try and make it a bit easier. And healthcare, that seems quite difficult to do that. Like if we're speaking about maybe going to appointments, as myself being a patient of Crohn's, so I'm in hospital. I go for appointments quite a lot to the doctors, and having to constantly explain the situation over and over again to different healthcare people. It could be a person at the person that you're supposed to be going to. It could be your consultant. It could be anyone. And I think it's really important. So when you get into the room, how, especially being autistic as well, how people are speaking to you, like their tone of voice. I always pick that up, and you kind of know if a healthcare person wants to help you or not on that kind of basis of how they're speaking to you. Because normally, this is the really annoying thing. Because if I go to an appointment, and because with my autism, get there on time, I'm on the dot when I'm supposed to be there, and then I'm there an hour later. The consultant's running late, and I'm only in there 5 minutes. So I'm in there 5 minutes, and then I'm gone. But the thing I think that like we say, there's so many different people out there. Like we spoke about the different communities. I think I spoke about this recently when I did a speech, and what I said was that a lot of people focus us on as a group rather than a person on his own, because they think we're all the same. And definitely not the case. If we were all the same, I don't think we'd be here now. We'd know what we'll be saying all the time, and there would be no need for anything really. But yeah, I always think that, because not just with healthcare, with anything, I think it's like that. And I think just when we do like these panels and talking about it, and hopefully it helps people out there, and hopefully there are healthcare people and that sort of watching, because it will help them, and then that they can even take it in to the hospitals all over the world, so it makes them understand better. Because you don't expect, so when I go to places and I talk about my Crohn's, I don't expect everyone to know what it is, but the more awareness about it, the more people understand and know about it. And you may feel about anything when you explain 100 times, you may get tired and get burnt out about going on about the same thing over and over again. But by doing that, I think that the plan is, if it annoys someone and you'll keep on talking about it to them, you're doing a good job. It might be annoying, but at the same time, it's getting into their head, and if it's getting into their head, they might go and think about it more, rather than just going over it once, to keep going and going and going. So yeah, that is what it means to me. Just a better understanding, making compromises, and yeah, just making it a lot easier for us.
I love that. And Mason is a host of a podcast, which is really fantastic and has great conversations with patients and autistics from all over the world, talking a lot about the healthcare experience and what that is, and advocating and definitely talking about the intersections of different health conditions, along with co-occurring things along with neurotype. And I love that. And Mason, you brought up a couple of things that are really big. So I formerly worked in healthcare and healthcare administration, and for one of the largest healthcare networks in the Southeast, in the United States. And that was something within our cardiology department and our heart cath lab, and patient transport and environmental services. When you're in the hospital or when you're going for procedure, Mason, you brought up something that I was like, oh, I so relate to this. And I kind of saw Bex and Janelle also sort of nodding that this was definitely a common experience I think so many of us have had, when you've had to repeat yourself to every single person you come in contact with. I mean, from your patient transport person at the front door, your linen services, the person that's just checking you in at the admin desk. I mean, and from the autistic perspective, I mean, just for people in general, I think this is exhausting, but I think for us in particular, this is really draining. And it's like, especially if we're talking about burnout, because that's my jam. We're talking about how many spoons do I have today? And by the time you've made an appointment or you've gone to get something taken care of, it's taken a long time to get to that point. And then you're having to not just explain everything, you're then having to repeat it ad nauseum to every person you come in contact with in the entire process, right? And then another thing that I think you touched on, Mason, that's really important when we're talking about accessibility, we're talking about understanding different neurotypes and communication within the context of healthcare. And that is, from most procedures and from most appointments, and Bex, I think you could probably help me kind of talk about this a little bit too. From the physician side of things, is based in the United States for insurance, it's like, okay, essentially what we end up doing is we have to book this this amount of patients within this time frame. Janelle, you can talk to this too, and about the mental health practitioner side. And, in the practitioner side, you may have 10 to 15-minute window, and you have this number of patients that you have to see. And, you're meeting all these practice requirements, you're meeting all these insurance requirements. And that doesn't allow a lot of processing time for folks who have processing differences. And I had to learn to do this for myself. I had to have a list of things written down, because I would go in, we would have a conversation, and it was going to get derailed. So I didn't get to share the things that I was in the office for in the first place. They'll pick one thing. That's what we focus on. And your 3 or 4 other things, just make an appointment for each one of those and come back. And it's like, oh my gosh, do you know what it took for me to get here in the first place? Can we just not take a deep breath? Give me 2 seconds. I have had a physician stand at the door with their hand on the doorknob the whole time. Not even sit down, not even, take the second to just let me know that I've got some space to take a breath and share what's going on. That's a hard thing. And when you don't have processing time, and you're not aware as the person on the other side that, hey, I need to give the other person some time to maybe process this, or how do I come back? That's the thing, is after I've had a chance to maybe think about what you've said, especially if you maybe gone over some test results with me, who do I contact to go over this once I've had time to digest it? Because if you go onto your patient portal, I had a friend, as she was sitting in her doctor's waiting room, she got a notification from her patient portal that her test results had come in, and the test results were telling her she had cancer. And no one had spoken to her. And this was sent to her without any context or any preamble or anything. And as she got into the doctor's appointment room in the back a few minutes later, she held up her phone and said, "What is going on? I just got these test results while I was in your waiting room." And the physician hadn't even had time to look at it and had no idea. So, how are we coordinating? How are we communicating? What are the technology is great, but is it helping us? Is it hurting us? How in this healthcare process, are these accessibility things breaking down? And what can we do as patients, as providers, to start navigating these things? So as we're talking about barriers, and we sort of kicked off this conversation in these different topic areas, I'm going to kind of go around the room so we can maybe talk about these things. Bex, what are some of your thoughts about this when we're talking about, the patient care journey right now in accessibility? What are some of those barriers, and what are the intersectional barriers that maybe we want other people to be aware of, that and that you're aware of and want to talk about?
You're muted.
Yeah, they're
Sorry
both muted.
Sorry about that. So
That's okay.
where did I start? So as you were talking, I'm thinking about those issues from, the expression is both sides of the stethoscope. It's kind of cute, but because the barriers, and it's similar in New Zealand to the United States in terms of the time the doctor has and the pressures. It's not as bad. It's one of the reasons I moved there from the US health system, but it's still quite daunting. And that's one of the reasons I no longer practice medicine. And as an autistic person, as an autistic physician, I can't process those things in that time either. And I wonder, I think we're probably overrepresented in a way in medical practice and healthcare as providers, but perhaps not identified. um, and um, and some of the doctors that you see who might be considered to have poor bedside manner possibly are autistic, but that's not an excuse or a pass for being a dick. Sorry for my language. You know, my just as an aside, my blog post was censored. The words that I used, "don't make assumptions and don't and be kind," were not actually the words that go through my head. So I'll just leave it there. um, Right. How many people are listening to this? So as a patient, you know, I had a doctor in New Zealand who was always on time, and because he was always on time, I always felt really pressured. And I take my list and I talk really fast and I go through these things, and I never felt like I got really where I needed to be because I always felt so pressured because he was always bang on time. And then I had another doctor who, so I switched doctors, somebody who was always running late. If your doctor's always running late, it might be because they actually take more time with the patients. And for myself, if I had somebody that I knew was going to have barriers to coming back for another appointment, I would go against, I mean, that thing that you talked about, you know, if there's 6 problems on the list, make another appointment, talk about that problem. What's the most important problem? I mean, that's how we're taught as doctors to do things, because that's how, you know, time management and all that, all these sorts of things that actually just make my head spin. But I know that I was going to have patients who would not come back or could not come back for whatever reason, you know, whether it's money, whether it's transportation, whether it's just, you know, spoons, you know, whether it's anything, kids. I mean, if I think about all of the things, all of the privileges that I have that allow me to access healthcare, you know, rather than thinking about all the ways, the barriers. And then I think about many of my patients, because I've always worked with patients with lots of barriers and inequities. That's just the sort of work that I've always felt drawn to. You know, people who don't have internet, people who have kids and don't have childcare, who don't have reliable transportation, who don't have enough money to put minutes on their phone so they can call and cancel an appointment if they can't make it. And then they're labeled as chronic no-showers or, you know, just problem patients. And in some cases dismissed from the practice or whatever. I would try to make those accommodations, but then I'd always run late. And it just got too much for me, and I just couldn't take it anymore. I still have student loans, but I've quit practice, so that's a problem. But anyway, so that's another barrier from the physician side. But where was I going with that? So yeah, it sort of goes both ways, and I feel like, you know, it's been mentioned, you know, what Janelle said about the thoughtfulness, the mindfulness. Just I like to, you know, when I'm talking to people or writing things, to put yourself in the shoes of someone who maybe they're going to a foreign country where they don't really speak the language. Now, as doctors, we don't quite get that just about everybody we see is, you know, accessing a place with a foreign language. Most people don't speak the language doctors speak. And then you add, you know, I just think about, like, how do you make an appointment? How do you get there? All of the other things that we talked about. And yeah, just trying to think about what it might be like for somebody who can't see or can't walk or can't talk or can't think fast enough or express themselves, or finds that the waiting room is too noisy and bright, or that making a phone call is an incredibly difficult thing. And I just had this example of an experience a couple of weeks ago, where I actually walked into the clinic where I go to see my provider, because it's around the corner from where I work, and that's much more comfortable than going on the phone. And I walked in and I met up with a friend who's blind. And she had an appointment, and she walked in to the desk and they handed her a clipboard with a piece of paper on it and asked her to fill this out. And she said, "I can't, I'm blind." And then I was standing behind her. I said, "Would you like me to help you?" Because she was a friend. I wouldn't have probably done that with a stranger for various reasons. One is I don't necessarily want to assume people want my help or whatever, but also I don't talk to strangers, not because it's unsafe, but because I'm autistic. Um, but she was my friend, and she's like, "No, no, it's okay," because basically it was just reviewing prior information. She said nothing's changed, and she gave it back. But I was just like, "That's unbelievable," that somehow they didn't know that they didn't see her dog hanging out under the desk or whatever. But and then I went in and I made my appointment, and I felt really awkward because I had to actually stand there and say what the appointment was for, and people in the waiting room could hear that, that sort of thing. And then the appointment's 2 weeks away. It hasn't even happened yet. And I have 2 weeks because the doctor went on vacation, which of course they're entitled to do, where I have to worry about what I'm going to say, and am I going to have enough time to say it, and am I going to forget something, and I'm an overthinker, and I'm then as a physician going to the doctor trying to solve my own problem and go in and tell the doctor what I need, which isn't really that useful. So I'm kind of rambling, which is something I also do when I go to the doctor, and then their eyes glaze over and so forth. But so I hope nobody's eyes are glazing over and they're going off to sleep.
No, not at all. And,
Um,
Dr. Bex Canner, you do a beautiful job, and I love this. Bex is also part of Mind Your Autistic Brains NeuroDrive healthcare team, and does a beautiful job of sharing stories of their own experiences, but also interwoven with that of other patients, so that other healthcare providers can start to add that lens and perspective and understanding of intersectional population and the service of intersectional population within LGBTQ plus population. So if you need someone to come in and do a workshop or a presentation to help you have that lens, please contact us, because Bex would love to come or virtually come to your facility and help you with this. Bex, thank you for those insights, because I think that's something that we all I think most of us tend to overthink the stuff because we want to make sure we don't forget anything. So that is so relatable. Janelle, what were you thinking as we're talking about, like, processing time, from both sides of the stethoscope, so to speak, and sort of like that repetition? What was coming up for you around this conversation in these accessibility areas today?
Oh, wow. I was nodding my head a whole lot when you're thinking about both sides of the stethoscope for a doctor's reference. In mental health, we talk about things like self of the therapist and counter transference and things that are happening on the therapist side that impact what's going on with the clients or the families, and vice versa. Um, so not just as a therapist, but also as a person with several disabilities and chronic ailments. Um, some of my disabilities, kind of like what Bex was saying, they're recently diagnosed. So like I'm new in the last like 3 or 4 years of having to go to the doctor a lot. And before it just wasn't, and I wasn't going this frequently. So I was nodding furiously because I'm like, yes, that's totally what it's like, having to make appointments, and the sheer stress of managing systems. I think that is something that, and I've heard you talk about this, Carol Jean, about burnout, for autistic burnout, about how it's really a disability tax, what it's like to manage these systems that weren't built with us in mind. And so everyone's just like, oh, call this person. And then you call them and they don't have the answer. And they're saying, you need to call this other person. And then you call them and they don't answer the phone. And then they call you back at a time that you can't answer, either because you're too busy, like me, or you're autistic, and heck no, you're not about to just pick up this phone to talk to this random person at 6 o'clock at night after you've had a long day and you can't even put a sentence together. So, so then it's like this vicious a game of phone tag for a week, and you're over it, but you need to go to this appointment like you have an ailment. So it's just, it's exhausting. I think systemic barriers are one of the things that really drive me to advocate and also do things the way that I do in my own practice specifically. It's all about having multiple ways to communicate, having ways that people can be independent or interdependent, whatever works for them, that don't really have to involve you. So yes, you should be able to go online and just make an appointment and not have to talk to anybody. Just go make the appointment. You should be able to email, phone call, uh, message. Like there should be multiple ways to get in contact with people. If you need someone to actually walk you through processes step by step, there needs to be someone that can help you do that. Just all the parts need to be there. I think specifically since COVID, one of the challenges that is newer, I think, but it's always been, but it's just more prevalent now, especially in the US, is lack of staffing. And so people are just overworked, underpaid, over it. And you can't be mad at them because you get it. But then at the same time, like you need to be served, you need to get to your appointment. So that is definitely a more prevalent barrier that I've been seeing for myself and for folks that I work with, about just how can I get in touch with someone? How can I get what I need? Why am I having to jump through all these hoops just to get an appointment? And then once you're there, kind of like what y'all were saying, just making sure that you're prepared. I think one of the best things about, and yes, I'm going to promo therapy. Therapy is for the strong. One of the best thing about having a therapist when you are a disabled person, when you're a neurodivergent person, you're an autistic person, is you can work with your therapist on helping you get set up for success with your other healthcare providers. So we do this all the time. Folks come in and they're like, I'm stressed out about going to this doctor. I don't know how I'm going to do it. I don't know what I'm going to say. And we've had sessions where we're working with a person or a family to like, okay, how is the conversation going to go? Let's practice the conversation. Okay, let's write down everything that you want to share with this person. Sometimes, especially if you're an autistic or you're not a neurodivergent person, you just need someone to kind of assist you with that process. That's why I think neurodivergent people really benefit from therapy. And so you can do that with your therapist. And then you feel way more prepared to handle what's going on. Therapists can even like call on your behalf to make sure that you're getting in contact with the right people, depending on who you're working with, if they have the capacity to do that. So, I don't know how I got off on that tangent because I'm going to.
Oh my gosh, that was perfect. I mean, that is like really important. I love that you brought that because, that's if we're talking about processing time, having a therapist, having somebody that you have that might be a life coach, having somebody that you have maybe just in your relationship network so that you can process. I have an auditory processing delay, but I'm an auditory processor. So I really need to have somebody to talk something out with or sort of plan how I'm going to navigate something. And I love, love, love that you shared that and touched on that. That is really important. And I know a lot of the work that you do in the world, Janelle, is you actually go out and help do workshops and consulting, and you go into companies and practices and you're saying, hey, let me help you see some of these things. Let me help you navigate this. Let me help you put these accessibility things in place, because that communication and that access, we should totally be able to go online and just make an appointment, please. Please don't make me pick up the phone and call you. That is like, no, just no. My voicemail actually says, when you call me, hi, you've reached Carol Jean. Please do not leave a voicemail message. I do not check it. I prefer that you text me or you can email me. If you're a doctor's office, you can leave a short message. That's it.
Yes. And especially when you're thinking about families, like my household, between myself and my son, the list is long. the sheer number of medical professionals I have. If you're counting my therapist, there's 9 people on my medical team. My son has 4 or 5 people, and we're adding more. So when you're thinking about like people who are typically people who are neurodivergent, especially autistic, we're 2 to 10 times more likely, depending on the issue, to have these other challenges on top of that. And so that means our teams are big, and that means all these different people are contacting us, and we're just one human, and we're one human that has challenges with communication, having to navigate all those things. So spot on. Like we as the healthcare system, what I advocate for in education and in healthcare and in nonprofits, I'm looking at, how can you create systems and processes and policies that support your workers and the people that you serve, in considering the most marginalized folks that are there. If you design the system for the most marginalized people, then everyone else will benefit tremendously. That's how it works. But you have to have the most marginalized people in mind, and having someone that has multiple marginalizations be a part of your team or be a consultant for you that can help you build a strategy for that for your organization is just going to catapult the way that you function in this progressively diverse world where the 85% of people are, part of this marginalized population.
Oh, good. Yes, just yes to all of that, please. And we had Brian Bird join us backstage, and so he's going to be coming on in just a minute. So I do want to give Mason a chance to take a few minutes to sort of speak to these things, since he really kicked us off on this great topic of barriers around processing time and having to repeat yourself and all of these things, as we're talking about the patient side of healthcare as well as the service side, and how do we do that. So, Mason, I would love to know, just sort of as we're bringing this conversation to a close, because we're getting ready to announce the award recipient for this year's 2023 Shine a Light Autistic Advocate campaign for their service to others. And Brian Bird was our recipient last year. He is the founder and the coordinator of Autism Support Community, and he has been a wonderful mentor and guide and friend to me over the years. And so I'm going to be really excited to introduce him in just a minute. Mason, what would you say, like, because you kind of said this for a sec, so I want to touch on it. And you were like, when I'm having to repeat myself all the time and I'm having to advocate, I'm having to explain, what is Crohn's to everybody that basically looks at me like glazed over when I say, oh, I'm a Crohn's patient, or, this is what I do, I'm autistic, and all of these different things. So let's talk about like your experience of burnout. So if you were saying, like, what is burnout and healthcare, how are those two things connected, and how do they correlate for you? How would you sum that up?
They are really connected, because like you say, you go on and on and on, and like people will say to you, you don't look like you have like Crohn's or autism, and unfortunately the world is based on what you look like. So you'll be more classified as disabled if you're in a wheelchair, which you are, but you're also disabled if you're not in a wheelchair. And whenever I am in hospital, I have someone sometimes called a liaison nurse who will be with me to support me. And one thing that it's really hard when you're a patient and you see consultants and doctors, it's really hard to trust people. It's very hard, because it's your decision at the end of the day if you want to take a medication, if you want to do a certain procedure, and it's really hard. And end of last year, I did a podcast episode, and we were talking. I had a healthcare provider and also another chronic illness patient, and we were going around all these articles, and one that popped up was where a healthcare professional with a patient that was unaware of what was going on in their life, and what it was the doctor as such was on the computer, going on, I think it was YouTube or on TikTok, trying to look up what it was, and they were saying they knew everything, so they weren't being truthful to the patient. And I think that's really hard, in both, in that situation, in both ways, because you, as a doctor, as a professional, you don't want to say no to people, but at the same time you've got to be truthful. And one thing as well in hospitals that I think is which we really need more of is, because being a patient in Crohn's, say if I had a flare up or something, you go automatically to the A&E unit, or and it should be the case, because I always say it, and it needs to change. And one thing I really want to change in the chronic illness community, because you have a flare up, you might, and it's not pain on the outside. A&E focuses, like, if you've broken your leg and you go there, you have to explain yourself even more, which links into burnout. You go to the person at the desk, they say, why are you here? I'm here because I'm in a flare. And then you're waiting 10 hours straight, and you're in more pain that you was at the start with. And then you think, which is why a lot of people don't want to go to A&E. There should be another unit that is there, and things. And really hard being autistic as well, because you don't like, I don't like being with loads of people, and it's really packed and really close contact, and it's really hard to get rooms that you can go in to just be there on your own and just have some space for yourself, and that's really hard. And another thing about burnout is, I think we focused on this a little bit earlier about forms, and the thing about forms is, which, like, say you're going to a new practice or somewhere, and you have to sign everything, don't you? You have to sign everything. You have to put your name. You have to do that, and then what the problem is, they don't give you enough time to do it. So to say, maybe a year or two ago, I was at a dentist, and they tell you to sign everything in person, which I think is much easier. If they say sign it at home, you have as much time as you want, and it's all a big rush if you're in the practice. And then they say, and then you get called for your appointment, and then you're saying, I haven't filled it all in, and then they say, don't worry about it, you can do it later. But they say that, but you'll never do that later, because you just won't. Like, we're not going to happen. So there's so many things with burnout and healthcare, and lots of things that does need to change within the understanding of it all. But yeah, I think burnout is really a thing that is there, because you're always burning out about loads of things. Like, it could be a whole topic that needs to be learned, and like, there needs to be more teaching, training even for the people. So because I always love it.
Yes.
Just last thing, Carol Jean, I love it when people have chronic illness themselves work in the healthcare system. I think that is the best thing, because you understand them, like you understand someone has a chronic illness.
Yep, absolutely. And I thank you so much for hitting on those topics, especially around the paperwork issue. We're looking at, what are those barriers? How can we, as patients and practitioners and advocates, start these conversations? So guys, I am so excited to welcome to this stage Mr. Brian Bird, our 2022 Shine a Light Autistic Advocate Campaign winner for the award for his service to others. Brian, thank you so much for joining us today. I am just thrilled to be able to have you here to help me present the award to our 2023 winner. But as we get started, before we announce our winner today, Brian, I would love for you to just share, what does accessibility mean for you and to you? Because your advocacy work with autism support community is so powerful and so important and so needed, and it does provide so much accessibility. What is that for you, my friend?
Well, yeah, firstly, hello everybody, and it's so nice to meet everyone on the panel. And I must say, I've learned so much just listening to you guys talking just now. It's fascinating. Yeah, well, for me, accessibility, I think when I got my late diagnosis at the age of 50, that was some 12 years ago, I was diagnosed. I was autistic, and that was it. There was no support. There was no. I wanted to get back into work, and I couldn't. And there's all sorts of barriers, and I didn't know anything about myself. I didn't understand the condition. All I know is I've been diagnosed with autism. Both my lads are on the spectrum as well, and I didn't know where to go. And it was a very confusing time. So in the end, I had to become my own support system, and I set up my original page on Facebook, and that kind of took off for a while. And then I went on to Instagram, which has been an absolute blessing for me. I've met so many nice people, including Carol Jean, who is, I'm amazed. She always amazes me. The best advocates out there. You're absolutely brilliant. I know you inspire me every day. Anyhow, I was on Instagram, and I started to meet people from all over the world, really. And I started to get more speaking opportunities. And I must say, I'm grateful for all the opportunities I've had to sort of have public speaking and do this sort of thing and grow as a person, I guess. So I think setting up a community and learning at helping other people is very cathartic, and to recover from a life of trauma, an early life which was very traumatic. There's no better feeling than helping other people, and I think that's my reward when I can help people get their diagnosis, or if there's one or two people who have been suicidal, and I persuade them to think otherwise. All these sort of things are really important, and I realise how hard it is for autistic people to get into society, to feel part of society, and that's why the autistic community is so important. It really is a life source, an important resource for neurodivergent people, not just autistic people, of course. So it's creating a platform there, I hope is fully inclusive, but I am aware that we will always do better and try to include everybody in. So I don't know if that all makes sense, but that's kind of just being there for the community and learning from the community is very important to me.
And I think you just learned why Brian was our award recipient last year for his service to others. I think you just heard it from his own voice, his own lips just now. Brian, thank you so much for all of the advocacy work that you do. Thank you for the mentorship and the friendship and the community and the kindness and the leadership that you have provided for so many of us. And for so many of us who have entered the advocacy space, you have truly been that guide and that leader that has helped navigate some of those challenges that we have faced. When you become an advocate and you start speaking out and sharing your experiences, you know, there are those things where we encounter that sometimes not the nicest or the kindest things that come back to us from the world. And you have been such a wonderful guide and such a wonderful leader and mentor in helping so many of us navigate sometimes those hard places in advocacy work. Thank you, thank you, thank you for all the work
Carol.
that
Thank
you
you
do.
very much.
You have been such a wonderful friend and guide to so many of us. Brian, I am going to do the introduction, but I really want you to announce the name of our Shine a Light Autistic Advocate Campaign Award winner for 2023 for their service to others. Our winner is
Janelle Johnson.
Congratulations, Janelle. We are so thrilled to be able to honor you and shine a light on the work that you do. So before I give Janelle a moment, I'm going to let her process and kind of digest this. Let me tell you a little bit more about the phenomenal Janelle Johnson. Janelle is a connection catalyst who brings helping professionals together who couldn't seem further apart using training, change management, and social justice empowerment. She is the co-owner of Bridges Family Life Center, along with her multi-generational family, where the focus is on reestablishing the institution of family in America. Janelle is an advocate for racial justice and mental health care. Janelle is also the current president of the North Carolina Association of Marriage and Family Therapy. She is a researcher at North Carolina State University, mental health volunteer, and a DEI consultant. Her focus is on solutions created just for education and healthcare leaders. Those subject expertise areas that she works in is mental and relational health for leaders, inclusive intercultural connection, anti-ableism, disability leadership development, intersectionality and DEIA, perinatal mental health, work-life harmony. Janelle Johnson is our 2023 Shine a Light Advocate Award winner for her service to others. Congratulations, Janelle, and thank you for the work that you do in the world and within our autistic community. If you would like to connect with Janelle, you can find her on LinkedIn and through the Bridges Family Life Center website. Also, Janelle, congratulations and thank you for your service to others.
Oh my goodness, y'all. Carol Jean. I'm so excited. I did not know this was going to happen. Thank you. Thank you for giving me this award. I'm thrilled to help the world see autism more broadly. I'm excited to help people to understand that autistic folks do all kind of neat things. It's definitely not just me. We're out here doing all kind of cool things. But I'm excited to do that specifically for Black and Brown leaders, Black and Brown entrepreneurs, Black and Brown academics. That we're out here, and a lot of times the work that we're doing is not, celebrated or centered or things like that. So I like to highlight what other Black and Brown autistic, neurodivergent, and disabled people are doing in the world, and that's a huge part of my advocacy. So I'm grateful. Thank you so much.
Shining a light on your work and the things that you are doing and the service that you provide to so many is my honor. And I cannot tell you how impactful the work that you do has been in my life and in my advocacy work, because I have learned so much from you, and I am eternally grateful for that. You will be receiving your award in the mail. It is a hand-painted sunflower, because that is the symbol for the Shine a Light campaign that you can hang. Brian, I know, has his, and he has sent me pictures and seems to love my painting, because that is what I do as my hobby. I love to paint. So that is one of the things that I do as my heart gift to you, to thank you for what you do, as I share a little bit of my passion and hobby in life, is that I do a painting. And so your award is a beautiful sunflower painting that I will be shipping to you. So keep an eye out. I'll be contacting you to mail it to you. Guys, thank you so much for joining me today, for being part of this healthcare conversation. Amazing advocates in this room. Please reach out to each and every one of them, to Dr. Bex Canner, to Mason Milne, to Brian Bird, and to our award recipient, Janelle Johnson. We are here to encourage, to uplift, to share, to help take your advocacy, be that just for yourself, or if you are advocating for a specific area or group of people within your own world. We want to help shine a light on you. Reach out to each and every one of us. If you need burnout help, I'm your person. Come check me out. I'm glad to help you navigate all of this, because we know that just tends to be such a big part of our experience. Connection and community are so important. As we close today, I have a wonderful link here that shares a little bit about a platform that I've partnered with called XXO Connect, and I'm live every Thursday. So this afternoon at 3:00 is our neurodiversity communication room, where you can come and have neurodiverse and neurodivergent and neurodistinct connection and community over in XXO. Thank you to all of our panelists today, and thank you for being here and part of the conversation in our audience. Take care, guys, and we'll see you next time.
Are you looking to experience healthier relationships with yourself and others while prioritizing your own well-being? Ready to remove layers of masking and get off the chronic cycle burnout loop? Mind Your Autistic Brain is a proud partner with XXO Connect. XXO Connect is a 100% live group and one-to-one video connection platform supporting your well-being through fun daily live rooms, connecting you to self, coaches, and community, including your ND community. Recharge inside self-care rooms. Activate mind-body-soul connection in live guided meditation rooms. Dive into mindset rooms with a former UFC MMA fighter. Restore energy in burnout prevention and recovery rooms. Raise your love signal with sex, dating, and relationship coaches. Align and elevate clarity in yoga and energy healing rooms. Experience deeper connection and healing in conscious community breathwork rooms. Improve your relationship with money in financial wellness rooms. Navigate life after divorce in parenting rooms. There's nothing like being in a room together, sharing energy together, supporting together, being coached together, healing together, feeling together, growing together. Live human connection every day, connection in every way. Living the whole human connection experience together on XXO Connect. Join me, Carol Jean Whittington, on Thursdays at 3 p.m. Eastern Time every week for Neurodiverse Connection, where we focus on burnout restoration, communication in our relationships, and so much more. Sign up today to join XXO Connect and me at the link in the show notes below.
Guys, thank you so much for being here. Join us next Thursday for our final live Shine a Light Autistic Advocate campaign discussion on accessibility in education. We're going to be joined by an incredible team of advocates who are working in the education space, including Jackie Edry, Ian Rayan from the Philippines, and also my good friend Corinne Gilmore. We'll also be talking about some of those IEP things here in the United States. We will see you next week, guys. Take care.